Hey there, I'm Shauna Cohen, certified skincare therapist, and this is your quick guide to Botox and everything in office to help with the signs of aging. First off, let me say I'm not a doctor, I am not a nurse, and I'm not a practicing medical esthetician. As I said, I am a certified skincare therapist, and I have been trained in general medical aesthetics. I've also tried a few myself. As the founder of the Clean Beauty School, an online resource and e-commerce site dedicated to skincare education, I'm all about offering honest and holistic skincare advice. I'm always open for answering any questions that my customers' clients have. Specific questions pertaining to treatments, I do recommend going to see your dermatologist or medical spa. They should always offer free consultations before any treatment and advise you on specific contraindications or if you are a good candidate for the treatment. If you aren't offered a free consultation beforehand, I would recommend going to see a new place. That said, this is about giving you some general information from someone who is not trying to sell you a treatment. I want to offer you unbiased information so that you can make these decisions for yourself. There's a lot of controversy surrounding the industry that's built on anti-aging, skincare in particular. The term anti-aging suggests that we're trying to look 20 when we're not. But for the majority of women that I speak to, and myself included, that's not really the case. Maybe you feel this way too. So using the term anti-aging to label the desire to look fresh or age gracefully kind of throws shame on anyone who's participating in the anti-aging skincare industry. And it even can suggest that they're vain for wanting to do anything about the signs of aging. But life takes its toll. Kids, stress, maybe the transgressions of our youth, a little bit too much sun when we were younger, maybe too much partying, whatever it is, the signs of aging will come. On the other hand, just like many other things, people do often want a quick fix, which may come with more risks, rather than opting for a longer-term solution. I'm a proponent of holistic skincare, which takes into account diet, lifestyle, mental health, and all has effect on the way our skin looks and ages. This is why I like to use the term healthy aging over anti-aging. I also need to say that there's many levels of action that can be taken to help with the signs of aging. And you can create a solid skincare routine to help support your skin as it ages. That's why I created my Healthy Aging course to help you cut through the BS and save time and money on figuring out what actually is scientifically proven to work to help with the signs of aging and how you can create an effective, healthy aging skincare routine. But more on that at the end of this. So there's misconceptions about treatments. If it isn't a traditional facial, then people often get scared and think that it's super risky or unnatural to do anything that requires a cosmetic treatment. That's not really true though, because there are a lot of non-invasive treatments available to you that are really little to no risk, and as long as you've been properly assessed beforehand. And these just can be a little bit more effective to treat the signs of aging than most topical skincare. You know, even a facial can do harm if it's not done properly or it's not the treatment for your skin type. So no matter what you do, even topical products can do harm to your skin. So you really just have to weigh the risks and assess what you're doing and why you're doing it. So let's get into non-invasive versus invasive treatments. So technically, non-invasive treatments mean anything that's not surgery. But I like to distinguish it a little bit more finely, and because surgery in my mind is, I'm not even going to go there today. So a non-invasive treatment I like to categorize as anything that doesn't puncture the skin. So for example, injectables, Fillers or microneedling would be invasive, and intense pulse light or superficial chemical peels would be non-invasive. Non-invasive, I find often people draw the line at that's their comfort level when it comes to cosmetic treatments. But let's get into some of the other treatments. So what are your options for deeper wrinkles, fine lines? So lasers are one of the go-to procedures to help with deep wrinkles. The deep lines are wrinkles that are on the skin when you're not smiling or showing expression. Some topical skincare may be able to help the depth of wrinkles a little bit, but cosmetic treatments are really the only way that you can reverse or significantly improve the signs of wrinkles. Now, lasers are one of those treatments that are often used, and there are ablative and non-ablative lasers. Laser treatments direct short, concentrated pulsating light beams at skin irregularities to promote collagen growth and to remove skin layers. So as I said, they are used on wrinkles, they can be used on acne scarring, anything that requires a deeper ablation of the skin. So the lasers create a targeted, very controlled injury to the skin that then stimulates the skin wound healing process. So ablative lasers are the most effective at treating wrinkles. They also require the most downtime, and they could take up to 7 days of recovery, plus your skin may be pretty red for a couple weeks afterwards. They are very painful also, but require fewer treatments to see significant improvement. Non-ablative lasers don't completely remove the layers of the skin. These are obviously a little less intense. They are significant less downtime. You might be 3 to 5 days with some swelling and bruising and redness, but it's nowhere near the same as the ablative laser. Now, these aren't as effective for treating deep wrinkles, but can help with fine lines and wrinkles as well. In terms of other options for hyperpigmentation and help with some fine lines, maybe collagen production, intense pulse light therapy or broadband light therapy are really popular. These are not technically lasers, and it is short bursts of light that really target hyperpigmentation, as well as they can help with capillaries. Redness is really popular for rosacea as well. And these require pretty well no downtime and can be done really quickly and efficiently. It feels a little bit like an elastic band hitting your skin. This is really popular to target sun damage or to really even out skin tone. It's not recommended for anyone with melasma because of the heat. Again, it's required to have at least 2 to 4 treatments to see significant improvement, and they would be spaced out 4 weeks apart. And again, it's a little bit of an investment, time and money. Microneedling is an alternative to perhaps some of the laser treatments, albeit it's not quite as effective, especially for deep lines and wrinkles. It can help with some pitted scarring after acne, as well as hyperpigmentation. It does puncture the skin because they're tiny little needles in a microneedling wand that requires a targeted wound so that the skin stimulates collagen and elastin as it heals itself. The treatment is a little bit painful, but you would get a numbing cream beforehand to really help ease the pain, but it really does not have too much downtime. Again, it's going to require multiple treatments to see a significant improvement. When it comes to sagging or loss of elasticity, plumpness, your best bet is ULP therapy, radiofrequency, thermal energy treatments that use targeted heat to really address those areas, stimulating collagen and elastin. Some of these treatments can be a little bit painful. Again, they'll help with numbing agents beforehand, but they can be quite effective. Now, chemical peels are one of those things that I think a lot of people are really scared of. There are 3 different levels of chemical peels. So this is you have your superficial lunchtime peel, you have the medium depth peel and then a deep peel. Now, chemical peels use ingredients that you might already have in some of your products, like glycolic acid, lactic acid, salicylic acid, depending on your need. It's just at a higher strength and perhaps a lower pH so that you are getting a deeper peel. Superficial peels are pretty non-invasive, require really no downtime, and just really help brighten the appearance of skin. It might help with some hyperpigmentation, and are a very popular treatment, especially in hand with other cosmetic treatments. Medium and deep peels really do require more downtime, and they can be pretty traumatic on the skin, especially deep peels could result in more infection and risks associated. All things to consider, and I think there's better, less risky options out there than the medium to deep peels, depending on your needs and the results that you're looking for. You also want to keep in mind, healthy skin really is about promoting a healthy skin barrier function. And that skin barrier function is, the top layer of your skin that's really going to help protect against environmental damage, stressors, inflammation. And keeping your skin healthy is a number one way that you can help prevent some of the signs of aging and really help age gracefully, preventing water loss and inflammation. Now, you have to consider that some of these treatments will harm the skin barrier function, perhaps temporarily, but if used excessively, can permanently harm the skin barrier function and your skin's health. So keep this in mind when looking at other options for treatments. I think the sweet spot with any treatment is really finding one that can promote the health of the skin while helping you achieve some of your goals. This is where consultations with your medical spas and dermatologists is really important, and doing your own research. This brings us to the last two treatments, which are, I'd say, some of the most popular and probably the most effective ways to actually help with wrinkles and loss of volume. It is also an invasive treatment, in my opinion, because it is puncturing the skin and there are risks associated. So let's start with fillers. So for loss of volume, injectables, fillers are really the most common way to help with this. They can also help fill out some of those wrinkles, so it's kind of a loss of volume / wrinkle solution. Dermal fillers use gel-like substances that are injected into the skin. They can address a number of concerns, including smoothing deep under eye circles, lifting cheekbones, volume in the lips, smoothing lip lines, the nasolabial folds, which are here, and also used on the hands. The dermal fillers will last approximately 6 months. They're not permanent, and they will eventually just get reabsorbed into the body. Some of the most common brands like Juvederm and Restylane are the brand names for these fillers, often made up of hyaluronic acid and a numbing agent. But with all injectables, they don't come without risk, and your doctor or injecting nurse is obligated to tell you all of the risks beforehand. With any injectable, you will have a little bit of downside. You might get some bruising and swelling in the area, a little bit of pain as well. Those are the general side effects that happen. But if you are using someone who is not experienced, who perhaps overfills the area or does it incorrectly, your side effects will be far worse. So know the person that is injecting you. On to Botox. Botox is one of the most common treatments that I get asked about. It also comes with a lot of stigma and skepticism, curiosity. Botox is derived from a bacteria that causes botulism, which is very toxic. When used appropriately and with appropriate dosing, it is considered safe to use in cosmetic purposes. It will be metabolized within the body and removed within 3 to 6 months on average. So Botox works at the neuromuscular junction to prevent muscles from contracting. Botox is a brand name, just like Band-Aid or Kleenex, and you might see it under another brand name like Dysport. So Botox is not the same as filler, and it can't be used to address all forms of wrinkles, unlike fillers, which provides volume to really fill out any of the wrinkles. So Botox does really well on specific lines like in the 11s here, some forehead lines, around the mouth, but it can't address all wrinkles. Botox will also not prevent sleeping lines, so it can prevent some of those dynamic lines caused by smiling and facial expressions, but if you're sleeping and you're squishing your face up against your pillow, the creases and lines that are forming on the sides of your face, Botox will not prevent. So there are some side effects of Botox, and again, your medical practitioner is required to tell you all of this. Some of the most common side effects really are just the minor bruising and inflammation that you might get, say, even with a dermal filler, which really will resolve within a few days. You know, there might be some systemic side effects, systemic meaning that it affects different areas of the body beyond the injected site. And so you might get some headache, there might be some fatigue, neck pain, double vision, allergic reactions. I mean, at the most severe, difficulty swallowing, difficulty speaking, severe muscle spasms. That is obviously at the very severe end spectrum to the side effects of Botox. So can Botox go wrong? Of course it can go wrong. Anything can go wrong. If too much Botox is injected or injected in the wrong areas, you can get some drooping or an overly frozen expression. Unfortunately, not a whole lot can be done to resolve this until your body metabolizes the product. So it could be, you know, a couple months before the effects wear off. Fortunately, it is a temporary thing, so it will eventually wear off. It's just, you might have to live with it for a little while. So you have to consider, yes, it is considered safe. It is a small dose. It is administered in a very controlled setting, hopefully using a practitioner or doctor that you trust and know well, to do what you are intending to do. The one thing to consider is that there's not a lot of long-term evidence for the safety and use. It doesn't mean that they aren't safe over the long period, but they just haven't been studied. This is something to really consider when considering using Botox. It's also something that when people do start to use, it's not usually a one-time thing. It usually is a repeated treatment for many, many years to come. Can you use Botox too young? So preventative Botox or baby Botox is very, very popular these days. It's becoming even more popular. People are getting, Botox in their early 20s as a preventative measure to avoid the wrinkles down the road. Now, the idea is that if your muscles can't contract, those lines won't form. And so when you do hit the older ages, you're not going to have the same wrinkles that you may have had from years and years of dynamic expression. The fact of the matter, though, is that you may not have created those dynamic lines, but the aging process is still happening, and that loss of collagen and elastin is still happening. Botox does not prevent the loss of collagen and elastin, which is normal and part of the aging process. Sometimes after many years of use, this could result in the look of heavier brows or drooping, making the toxin actually a little bit more difficult to continue using. Now, Botox is getting a reputation as being quote unquote addictive. And it's not that it's actually physically addictive, but the results can be. And starting too young, you do start to see yourself in a certain way, and it is very difficult to stop. So these are the things you want to consider before starting. The fact that baby Botox, which is just really fewer injections, is encouraged in younger and younger demographic, is creating a lifetime user. Price is also a factor. It's not cheap to continue using Botox, and depending on where you live, for example, here in Toronto, the average price is about $10 to $17 per unit, and each section, depending on where you're getting it injected, will require so many units. So for example, in your forehead, you might be required to have up to 20 units. So it can be costly, and you are doing this every 3 to 6 months depending on how your body metabolizes the product. So it can add up. Anything you get done will require time and money and commitment, and so there is really no quick fix, even though some of these treatments I just outlined are quicker, but they do require consistent use, and especially Botox and fillers are not going to reverse wrinkles permanently. This is all to say that there's no judgment on which avenue you choose. Obviously, there's always going to be a risk when it comes to doing any treatment or procedure, whether it's invasive or not invasive. You do need to know the practitioner that you're using and trust their reputation. Obviously, no go to Botox parties, black market, ingredients or products, anything bought online. Please don't. And if you're looking for just a really solid skincare plan to help with the signs of aging, and you want to know more about what can effectively help the signs of aging, what you can realistically expect out of your products, and what your options are to really build something that is lasting and will help you age gracefully, then you may want to consider the new Healthy Aging course. So this hour-long mini course is designed to really cut through all of the BS that you've heard from beauty marketers and brands and companies and people trying to sell you things, and to really focus your attention on what products work, not brand names specifically, but what ingredients work, and how to use them in a way that will get you results. This also includes resources with product suggestions, but in general, just the format and your recipe for success. The signs of aging are inevitable, and it just depends on your comfort level, what you truly believe is important. There are lots of options out there for you. There's also a whole lot of misinformation. So I hope that this video was helpful for you to really help as a starting place to know your options. And if you want to know more about the Healthy Aging course and what you can realistically expect out of your topical skincare products and what products you should be incorporating into your routine and how to use them, make sure that you are on the list so that you can take advantage of that. Thank you so much for taking the time to watch this. My name is Shauna Cohen. I am a certified skincare therapist. You can find me at the Clean Beauty School, cleanbeautyschool.com, and I would love to answer any of your questions that you might have. And join me over on Instagram at Clean Beauty School, where I often speak about healthy aging routine and healthy skincare tips, and we can continue this conversation. Wishing you healthy and happy skin.